So for those of you who were here the last time, we spent a lot of time at the last session talking about a lot of the molecular biology and a lot of the kind of nuts and bolts things that happen inside of the human brain when it comes down with Alzheimer's disease. And Clark said, that's great, but that's not what everyone's used to listening to. They're used to hearing Bill Beckwith talk about other things. And I said, well, maybe we'll move in that direction the next time around, but you know, I wanted everyone to have a kind of a grasp of what's going on inside of the Alzheimer's brain. This time I thought it might be worthwhile to talk a little bit about what are some of the psychological things or emotional things that happen with these patients, because that a lot of times is very difficult for the caregiver to deal with. It is very tough. Sometimes more difficult than actually dealing with the memory loss portion of the disease. So when you think of Alzheimer's, Alzheimer's isn't just memory loss. It's actually many other things. It's failure of other parts of the brain. You can have failure of the language center. You can have failure of your ability to plan and do things. That's called executive function. You can also have failure of emotional control as well, and also failure of perception of reality. So a lot of these things encompass what Alzheimer's is. So it's not just memory loss. Yes, memory loss is really the core of it, but there's a lot of things out here that are orbiting around that core, and they're many times as important, if not more important, especially for the caregiver. So many times I'll find that when the patient first comes into the office, and now we're talking full-blown Alzheimer's, we're not talking mild cognitive impairment now. If you guys remember the last time we talked a little bit about mild cognitive impairment, that's a portion of the disease state where the patient is just a little bit forgetful. And now we're going to move on right into the Alzheimer's disease. These patients frequently are subject to swings in behavior, and the spouses almost always pick that up. So when the patient first comes into my office, I say, is there any change in the personality? Is Joe any different than what he was 20 years ago? And the wife will think about it for a minute and say, yeah, he doesn't go out as much. That's apathy. And that's actually one of the first signs of it, is that you lose motivation to do things. You know, Joe at one time was a really avid shipbuilder. You know, he liked to build little tiny model ships. He would spend weeks in the garage building these intricate little ships, wooden ships, and suddenly he lost his desire to do so. I don't know why. His talent was good, he just doesn't want to do it anymore. Or he used to like to go play poker with the guys every Friday night, and now he's not doing it anymore. So apathy is a big thing. Apathy is a very difficult thing to deal with because, number one, unfortunately, there is no medicine for apathy. If there was, we'd give it to every teenage boy in the United States. All right? Because they all sit there like a lump nowadays and play with their phones and their computers, and they don't do anything. So the apathy also interferes with other aspects. So when the patients come into my office and I tell them, look, this is what you need to do. You need to exercise. All right? And that's one of the things we talked about last time, that I really like my patients to exercise on a routine basis. They don't. And I ask them, why don't you exercise? Do your knees hurt? Does your back hurt? You know, is it too rainy, too humid, too cold, too hot? What? And yes. he just looks at me and says, yes. I just like sitting around. I just like watching The Price is Right, or I like reading my books. And I ask his wife, was he always like that? Absolutely not. When he was a younger man, he was never in the house. He was always running around helping neighbors with projects and doing this, that, and the other. So apathy is one of the earliest features to look for in this disease. Very tough one also. Also frustrates the family members no end. All right? Especially when Joe was a type A personality and now he's a type Z personality. Emotional instability. That's another common thing that we see, where the spouse may find that the person suffering with the disease may actually be a little more snippy. Whereas at one time, you know, this person was an emotional rock. You couldn't tell what this guy was thinking or this lady was thinking because she had her poker face, or he had his poker face on all the time, and now she asks him, what would you like for dinner? And he kind of snaps off on her. I don't care what we have for dinner, just make something. What's that all about? So they also have this emotional discontrol or lack of control that builds as the disease goes along. The emotional instability can be treated sometimes with medications. This one is responsive. We frequently use drugs like antidepressants to help with that. It does help. Also, sometimes when the emotional discontrol is really kind of far along the course and the patient is really looking like he's a bit of a threat to the family, you know, that he might actually raise his hand to the family member even though he would have never have done that in life, we try more powerful medications. We try drugs like Seroquel and Haldol. Now, these are the medications that have gotten a very bad reputation with the media recently. If you listen to NPR anytime, you'll hear that they're saying that doctors are over-prescribing these medications. And from my perspective, these medications are actually an important tool in helping these people, because without them, if this guy is emotionally out of control and they invariably have very good strength and he goes raising his hand to his 80-pound spouse, something has to change. Either he has to get out of that house or he has to go on some medications to help control that. And that's where you come into a very difficult situation. So sometimes the doctor's hand is forced, and sometimes just little tiny doses of these medications will actually help a great deal in suppressing the aberrant behaviors and keep that person inside their home environment, which is actually the best environment for them. Nobody's going to give you better care than your family. All right? Your spouse is going to look after you like you were a pile of gold bricks. You know, they're going to make sure that you eat, they're going to make sure that you get a bath, that you take your medication. The family members are the best. And the longer we can keep you out of assisted living, the better. Of course, there always does come the time where you just have to go to assisted living because your needs exceed your spouse's abilities.